All right, welcome back to Rook's Health. My name is Farouk Bello. In this video, I'm going to be covering the biomedical science, biological scientists, and biochemists health and care visa. It's been very much a requested video, one of the top ones I've gotten a lot of questions about. So I'm going to be covering what exactly is the key difference for biomedical scientists and biological scientists that kind of differentiates it from the other health and care visas, because there's a big consideration, especially with salary requirements and what you need to be considering that make it different. Then I'm going to be giving you some of the information that you need to know before basically you make your own application. Now, just to remember that none of the information I provide in these videos are legal advice or visa advice specifically. They're all based on personal experience and as well as publicly sourced information, which you can find by yourself. I will leave all the links in the description below so you can go check it out. And I do recommend you do your own research. Now that that's out the way, let's go straight into what we're talking about today. Now, if we have a look at what I'm looking at now, it's the health and care worker visa, which is basically a visa. If you don't know what this is, check out the other videos I've done specifically covering what it is, explained in general, and where to find jobs. Now, if we're talking about biological science and biological scientists, just so you know which jobs come under biological science I'm talking about, we'll just quickly have a look here. As we can see, biological scientists and biochemists, what comes under this is biomedical, forensic, horticulturists, microbiologists, and pathologists. So if any of those are basically interested in any of those, this video is for you, exactly what you need. But let's go back to the beginning. So the most important thing is checking if your job is eligible, which is always how you start with this type of thing. You go down this list, you come down, if you don't know your ONS code, you can search that, but yes, that's not that important right now. We'd just basically look at this list, check if your occupation code is eligible for this visa, the most important thing. And we can clearly see that biological scientist is on the list. So biological scientists and biochemists, the code is 2112. This will be very important later on in the explanation of this video. But okay, that's one part down, and just so you can see, physiotherapist, which I am a physiotherapist. I have work in the UK right now. I work in the NHS, and I'm originally Nigerian, and I basically did my education here, and I got a job here, and I went through this similar process about last year, so it's still fresh in my head, and I've been doing some research on it. But let's go down and see. I've already covered a lot of these things. What salary requirements, which is always the important thing. This is the thing I think is the most important thing that differentiates biomedical from the other ones that I've talked about or I will be talking about. So let's have a look. You will usually need to be paid at least $20,480. If the going rate of your job is higher than $20,480, you'll need to be paid the going rate. Each occupation code has its own going rate, and you can find that. Now, these are the jobs basically when you need to meet different salary requirements. These jobs here are the jobs that basically they don't follow the specific 20,480. They follow a going rate, basically the going rate of your own job. Now, if we can clearly see already, 2112 biological scientists and biochemists fall under this category where you need to meet a different salary requirement. So this 20,480 doesn't really apply to you guys at all. And you can see these other ones: lab technicians, dispensing opticians, pharmaceutical technicians, and etc. But let's now you're probably wondering, okay, so what is the going rate, which is the most important question. What is the going rate for biological scientists, which is what I actually have here. I have that here for you guys, which is basically, if I have a look at this, it's biological scientists and biochemists. The going rate is £29,700, also known as £14.64 per hour. Now you're already looking at this like, it's fairly high. It's fairly high. Okay. And then we come back to this, which is basically said, the going rate of this, but this is, and then you click on to see specifically what it actually means. Now, this is where I can imagine it gets confusing because I've already just shown you basically almost the same thing, salary requirements here, and I'm showing you salary requirements here. Now, this particular one, just so we're all clear, is actually if you need to meet these specific criteria. So they've shown you already here which jobs you need. Now, if you come back here, these are the jobs that need this different requirements. Now, specifically for biomedical science, biological scientists, you usually need to be paid at least $25,600 per year, £10.10 an hour, which is whichever is higher. And if the going rate for your job is higher than both of these, you usually need to be paid at least the going rate. Now, from the thing we already saw is that 29,700 is the going rate for biomedical scientists, but you need to be paid at least 25,600, which is giving you quite high marks. But you need to be, they're going to use the going rate, so you need to be paid at least 29,700. You would think. However, that's basically it. But there are certain circumstances that will allow you when you can be paid less. But we'll quickly look at this example so we can understand it if those who are maybe confused. Your salary is 27,000 per year, but the going rate for your job is 30,000, which is kind of similar to what we're saying now already. You don't meet the usual salary requirements, but that's the usual. Now let's have a look at when you can be paid less, which is the big consideration. Because if you're already looking at those things I've just said, you're already thinking in your head, damn, you either have to get 29,700 or you're not going to be able to go get a job, because that's the going rate for biomedical science. Now, if you have a look at when you can be paid less, which is very important, you might still be able to apply for a health and care worker visa if your job is eligible, but your salary is less than 25,600 or your job's usual going rate. You must still be paid £10.10 an hour, which is very key, and I want you to remember that number. £10.10 an hour is the minimum you can be paid. You can be paid around 70 to 90% of your usual job's going rate if your salary is at least 20,480, which brings it back to basically the going rate for everyone else. But the caveat is you have to fall under meet one of these criteria. Now, these criteria are very important. The first one you have to meet is your job is on the shortage occupation list. Now, for those who don't know what this shortage occupation is, it's actually the way, basically, if your job was on this shortage occupation list, means you were in high demand for a job in the UK, and usually meant that you could get a visa a lot easier than those who were not on the shortage occupation list, because it's basically saying that you're in more demand than some of these other jobs. Then if you're under 26, studying or a recent graduate or in professional training, the third one you either have to consider is you have a science, technology, engineering, master's, PhD qualification that is relevant to your job. I won't get too much into PhDs specifically for this video, but if you want me to cover PhDs, that's fine. I'm more than happy to. But to keep this video from dragging out longer than it needs to be, now let's talk about the first one, which I think is the very key one. It's, biomedical scientists and you guys will find very important. And the saving grace is that if we quickly have a look, shortage of workers in the UK, as I said, your job was on the list, you can be paid 80% of your job's going rate if you're on this list. Now, you're probably wondering, is biomedical science? And the answer is yes. Let's quickly come back to the top. This is basically the shortage list. Again, link in the description. Skilled workers, visa shortage occupation. Now we come down to it. So you see biomedical sciences is right there, 2112. That's where it's important again. And 80% of the going rate for this job is 23,760, which is very good because you're on the skill shortage occupation list. The salary is 23,760, also £11.72 an hour, which is higher than the £10.10 an hour. Therefore, if we come back and we have a look already, that gives you quite a good, basically description of where you're going off to. So we're on the shortage occupation list. You're over the, where is that? 20,480. What's it? £10.10 an hour, which is good, which gives you a good shot at getting this visa or making you able to apply for this visa at the very least. The other one that might be relevant to a lot of people is you are under 26 or a recent graduate. So you're under 26, you got a good standing there already, or you're a recent graduate or in professional. Basically, as it says there, and you can be paid 70% of your job's usual going rate. I'll leave you to do the math on that for the 29,700 for that. And these are the certain criteria that if you're on 26. Keep in mind, only one of these needs to be applied to you. You can be paid 70% of your job's usual going rate if one of the following applies. You're on a 26 on the date you apply. You are currently in the UK on a student visa, studying a bachelor's degree level or above, master's, etc., or you have been in the have been in the last 2 years, and a student or visit visa was your most recent visa. So that's for those who are already studying here, which gives you a good level. You're studying here already, you're under 26, and you're doing a graduate degree bachelor's, you're good to go for that category. And the other ones basically says you're working towards recognized qualification of in a UK regulated profession. Now, UK regulated profession for a biomedical scientist and myself is actually the HCPC. And the HCPC is our, governing body basically, and basically where you can check to see those who are on the list, those who are not actually on the list, and you can see biomedical science actually falls under this. Now, if you're not biomedical science, you need to just make sure you check which one is your governing body. But let's get back to it, the actual meat of what we're talking about here. And as again, PhD is a whole different thing, which I'm not going to cover in this video, but we'll quickly have a look at. This is a very important thing. Your total stay in the UK cannot be more than 4 years if you apply for one of these reasons. This includes any time you've already spent in the UK on a tier 2 general work visa. That is obviously a special case. If you've never been in the UK before, this it doesn't really apply to you that much. This is for those who are already here, particularly, and they're trying to apply on this visa, or they're on it, as it clearly says there you are on a tier 2 general work visa. So if this applies to you, make sure you take this into consideration. If it doesn't, don't take into consideration if it doesn't apply to you. Okay. Now, before I leave this video alone, there are a lot of different things I could have considered, and a lot of different things that can be talked about on a lot of these visas. But the important thing to know is that a lot of them already have the same process. Now, if you have a look here already, it already says check how much you'll need to be paid. Now, it's saying this because I would strongly recommend you have a look into this particular one a lot more, but I'm not going to go into it because it'll drag out the video, and I thought I wanted to cover the most important aspects of this biomedical science visa, things you need to be considering. Now, the videos I'll be making, the other ones, will kind of cover the whole encompassing health and care visa, because apart from the specific things like the ones I pointed out today, the kind of format is very similar to the other one. You need to get a job, you need to get a sponsorship letter, you need to gather your documents, you need to do this. Now, if we have a quick look at a few of the things, if you're, there's considerations if you're applying from outside the UK, if you're applying from inside the UK, the different things. If you want me to make a video on any of these, just let me know in the comments below, or like the video, as well as like the video, so I know this video didn't go in vain. But for those who are not even aware of the banding system, which is something that you need to familiarize yourself with, and I will do a whole video on the banding system for NHS, is if we have a look here, let's use necessary cookies only. The starting band 5, which is where people who are fresh graduates, if you come out of university, you start in the band 5 category. And most of the jobs, I've had a look at some of the jobs on NHS jobs. There are biomedical science, band 5 jobs, which is where a good way to start. And your salary will start around 24,907. And based off years of experience, it then goes up. So looking at this, if we consider the things we said, the only way, if you are going straight going rate of your job would be if you were 6 years already in the NHS as a band 5, which a lot of people, I don't think many people spend 6 to 7 years as a band 5. Or you went straight to band 6, which is basically a senior position in the NHS. And then you can start going band 7, band 8, but yada, yada, yada. You get what I mean. These are all pay step progressions based on seniority, experience, and multiple different factors. So band 6, technically, if you straight applied for a band 6 job and you got a band 6 job, you're technically over already the going rate. So a lot of those things don't even really matter to you, because you're over the going rate of your job already if you got a band 6. However, if you're not able to get a band 6, for example, you are a new graduate, you don't have that much experience yet, or you want to, you'll probably be starting at band 5 level. If you're a fresh graduate, depending if you're coming from the UK or you're coming from abroad. And if we quickly have a look as well, there are band 4 posts. This is obviously less than band 5, but the salary is the interesting thing you'll be looking at. Technically, it is 1 year of experience as band 4 is over 20,000. what's it called, 20,000. What was that number again? 20,000, I think 480. I think 480. But I won't confuse you guys with, band 4 stuff right now, because this is where you see, as you can see already, pharmacy technician, which is also on the healthcare visa, and these other things. So technically, it does also come into consideration. So you may not need to only have band 5, but this is a whole separate thing I can cover later. But it's the salary that matters, and the job post you're applying for that also matters as well. Salary, and if it's meeting the requirements of this health and care visa, which you just need to make sure you are checking out. If there's anything else you want me to cover on these videos, let me know, particularly if something wasn't very clear in my explanation. I've kind of glossed over some of it and stuck on certain parts that I thought were very important, so I don't drag this video longer than it probably needs to be. But do let me know in the comments, and I'm more than happy to answer your questions in the comments, or make a whole video, a part 2, if you say, about the different things I can cover in this video, okay? But I'll leave it there with all of you, showing you a few different things. One last thing, just so you can have a look. Overseas healthcare information, registration. You need to be registered to HCPC. You need to meet English proficiencies. But again, these are all different things I can consider in other videos. So I'll leave it there with you guys for now, and have a good day. And till the next video, make sure to subscribe, do the right thing. Thank you very much, and have a lovely day.